Hello, everyone. I'm Dr. Shikha Taneja Malik, Senior Program Manager at the National Biopharma Mission BioLAC. I'm a virologist by training and lead the vaccine clinical trial and related infrastructure portfolio. Today, I'm honored to be presenting my leadership project entitled Defeating the Human Papilloma Virus and Empowering Women in the Fight Against Cervical Cancer. Cervical cancer is the fourth most common cancer in women globally and the second most prevalent one in India. The highest death rates are observed in LMICs, despite the WHO recommendations and the availability of safe and effective vaccines. There's lack of knowledge regarding this virus and the cancer and its prevention. There's and cultural barriers towards discussing sexual health in our country. My project revolves around vaccine equity and adolescent health and aims to increase awareness on HPV caused cancer and its prevention. I've generated innovative IEC materials and have used a survey based approach to better understand the knowledge of vaccines and their acceptability in general, knowledge of the virus and the HPV vaccine among adolescent girls and parents in particular and also the HPV vaccine acceptance in the community. So I did a pilot study, one in urban population in a school in Delhi and the other one in a residential society in Pune. We had these discussions in Pune on the World Cancer Day, and there was quite a good response from the community. Preliminary data shows that vaccine knowledge and acceptability among parents is somewhere between intermediate to high, and the virus knowledge is also intermediate among the parents. Quite a few of the parents they had heard about the vaccine, but they did not know much about the vaccine safety and effectiveness. So, after our detailed discussion about the vaccines that are available, the safety, and the long lasting protection provided by the vaccine, I did a post discussion survey to understand the vaccine acceptance. And I was pleased to see that 73% of the parents shared that they would like to vaccinate their child. I had amazing interactions with adolescent girls in a school in Delhi. Over here, also, based on the survey, the preliminary data shows that vaccine knowledge and acceptability is intermediate to high among adolescent girls, whereas the virus knowledge is quite low. Most of these girls, they had heard about the vaccine, but they have very limited knowledge about the vaccine safety and the effectiveness of the vaccine. So before going into details of the vaccine and cervical cancer, I did a survey to understand their intention. So 50% of them shared that they were undecided with respect to vaccination because they did not know anything about it. But after our discussion and resolution, all the queries and all the clarifications, I did a survey again to see what was their vaccine intention. And it was quite good to know that 94% of the girls shared that they would like to vaccinate themselves and protect themselves from the cancer. The project also involves identifying peer educators and empowering adolescent girls and have a targeted approach in this population. There have been several key learnings. We've learned that adaptability and flexibility in approach is the key in when we are working in communities. Clear and effective communication goes a long way. It is very important to understand the diverse perspectives. And empowering through education is a powerful tool for addressing health disparities. Empowering through education, it leads to breaking down of barriers, barriers of misinformation, barriers of cultural stigmas. I plan to continue these discussions and have a wider outreach and expanded access. Over the past year, it has been an amazing leadership journey. I learned that impactful leadership is not about wielding power, but about creating positive change. I've always been very passionate about this community work, but could not take out the time from the busy schedule. As a part of the leadership project, I had the opportunity to lead an initiative that directly impacted the lives of girls and women. Through focused discussions and awareness campaigns, I witnessed the ripple effect of my actions. I further honed my strategic thinking by collaborating with diverse stakeholders, many a times moving out of my comfort zone. True leadership embraces diversity. I learned to listen, to amplify voices, and ensure that everyone feels valued. To summarize, my journey with Women Lift Health has been transformative. The 360-degree evaluation, interactions with the coach, mentor, and the wonderful cohort members provided valuable feedback, highlighting areas of growth and reinforcing my strengths. It reminded that leadership is not static, it's a continuous evolution. I plan to continue to be bold, authentic, and compassionate while putting in my level best to be impactful and relevant. Finally, sincere thanks to BIRAC and DBT, the amazing Women Lift Health and the CCL team, our wonderful India cohort, and my loving family. Thank you so much for your time today.